65 cases of coronavirus in Victoria. That is 428 new cases since we last updated you. 57 of those are connected to known outbreaks, 1 from quarantine, and 370 of those cases are under investigation by our public health team. I'm very sad to have to inform you that there have been 3 further deaths, bringing the total number of fatalities, total number of lives lost to this virus to 32 since yesterday. So the details of those individuals: there's 1 gentleman in his 80s, 1 gentleman in his 70s, and a woman in her 80s. I can offer no further information about those 3 tragedies, but we send our best wishes and our thoughts and prayers to their families. This will be a particularly challenging and very, very sad time for them. If any further information can be provided, then that would be a feature, I think, of the Chief Health Officer's media release later in the day. 122 Victorians are in hospital, 31 of those are receiving intensive care. Yesterday we had 24,409 tests, which is, again, a very impressive number. Very, very grateful to every Victorian who's coming forward, even with the mildest of symptoms, to get tested. As I've said so many times, but I'll keep on saying it because it is so important. That gives us the data, the certainty about where this virus is presenting, how it's moving through the community, and with those results we can trace people, make sure that people are isolating at home, make sure that people are limiting their contact with others, and also through those positive results and networks of close contacts, we can potentially provide care and medical intervention earlier than would otherwise be the case, and that can be the difference in terms of just how serious the disease presents and just how serious the health consequences are for those involved. That brings our total testing to 1,250,408 tests since January 1. Again, one of the highest testing rates anywhere in the world. I want to appeal to every single Victorian. If you have symptoms, even mild symptoms, please come forward and get tested. It's a relatively quick process. It's a simple thing in many respects, but it makes a massive difference to our collective fight against this enemy, against this virus. That intelligence, that information, that data allows us to really respond the only way we can, and that is to isolate people who have the virus, limit the number of people that they come into contact with, and therefore limit the spread of this virus. I'm deeply grateful to everyone who has been tested, and I would urge Victorians to come forward, even if you have the mildest symptoms, in order to get a test. Just in general terms, before I ask Brett to add to these comments, we are going to increase the total number of testing sites across regional Victoria. And in fact, Jenny can take us through that before Brett talks about the epidemiology of the day. There will be a number of additional test sites stood up. There's more than 50 of those already operating in regional Victoria. We do continue to see low numbers, albeit some additional cases in regional Victoria, around 5 today, further details of which will be forthcoming in that CHO media release later in the day. But they are relatively low numbers in the scheme of things, and we're comforted by that. These things can change rapidly though, and that's why additional test sites and expanded test sites are critically important. We're also standing up dedicated regional public health teams, so local squads who really can bring that intensive intervention to even the smallest number of cases, to really sit on those positive cases to make sure that they get the best public health response, that we catch them early and that we can limit their contact with other people. And I'm very grateful to those who have tested positive in regional Victoria for following those detailed quarantine rules, making sure that they stay at home, making sure that they're not spreading the virus through anything that they do. That's critically important, and again, a really significant contribution that those individuals, albeit small numbers, are making to keeping those numbers very small right across regional Victoria. That ring around Melbourne and Mitchell Shire is working in terms of reducing the spread of this virus into regional Victoria, but it can change. It can change if people don't follow the rules. It can change if people have symptoms and go about their business as if they didn't. It can certainly change if people pretend this is over because they really want it to be. That's not the situation we face. That's not the reality that we have to confront. Jenny will speak a bit more about some of those dedicated teams and the additional testing capacity in regional Victoria so we can try and stay a step ahead of the virus as it presents outside metropolitan Melbourne. Inside metropolitan Melbourne,
Victoria Premier Daniel Andrews speaking there live in Melbourne with the news that an additional 428 people have been diagnosed with COVID-19 in Victoria in the last 24 hours, and there have been 3 additional deaths.